Hi everyone, my name is Mayelin Ventura and my question was, should pharmacists be allowed to deny prescription on grounds of conscience? Yes or no? Pharmacists denying to fill a prescription on grounds of conscience. A person who objects on grounds of conscience or religious beliefs to perform a certain act has a considerable amount of rights. To force someone to perform an act against his or her religion would be a violation under human rights. No, that is not their job. They don't know the patient's background and it isn't their job to know. A medical doctor is responsible in proper dosage for a condition the patient has. The medical doctor is the one who takes the medical history of their patients, not the pharmacists. They can only make assumptions based on a prescription, and they have the responsibility to inform the consumer where they can purchase the medication. Why is it important? It protects patients' information history. Only the doctor can have this information. Patients can feel discrimination if a pharmacist denies any medication that they need. Pharmacists can't allow denied any medication if the patient have a prescription from the doctor. This can cause problems if the pharmacist follows their conscience and moral rights/beliefs. Background social issues and laws. In many cases, customers can simply seek out an alternate care provider. In other cases, no alternate is available, and some patients may be unable to access an alternate due to personal limitations. Other states' legislators are introducing legislations that will require pharmacists to fill any legal prescriptions for birth control. In Washington, D.C., law allows pharmacists to dispense emergency contraception without a prescription through collaborative practice agreements and state approved protocol. I don't agree that pharmacists can use their conscience during work time. A New Jersey law prohibits pharmacists for refusing to fill prescriptions solely on moral, religion, and ethical grounds. Important questions and dilemmas. Why do a lot of pharmacists want to use their conscience and moral during work time? On July 2002, a University of Wisconsin State student went to Kmart in Menomonee, Wisconsin, to fill her prescription for contraceptives, birth control pills. The only pharmacist on duty, Neil Nelson, asked if she intended to use the prescription for contraception. When she replied in the affirmative, he refused to fill the prescription, explaining that to do so would be against his religion and beliefs. Argument and my own position. I feel pharmacists should not be allowed to deny prescription based on their consciences because that is not their job. Their job is to help the patients with any medicine that they need. They can give all the information that the patient needs to know about the prescriptions. They have the right to give the necessary information, but not to deny any prescription. They have to do their professional job. The ideas and concepts of philosopher. Utilitarianism theory is a normative ethical theory that places the locus of right and wrong solely on the consequences of choosing one action/policy over other actions/policies. As such, it moves beyond the scope of one's own interests and takes into account the interests of others. This theory does apply to this theory because the pharmacist's job is to give what the patient needs. If the patient feels that they are being denied, then it is going to cause problems for everyone in a negative way. Conclusion. Pharmacists should not be allowed to deny prescription on grounds of conscience because this can cause many problems. People can feel denied, and also not everybody has the same concept. People have different beliefs and different religions. For that reason, it is better for every pharmacist to only do their job and not allow their conscience during work time.